How are you doing today, John?
I'm doing well. How are you doing?
Doing okay, doing well. How's that knee treating you? Dr. Clausen told me you've got some pain going on there.
Yeah, just some arthritis in my knee. It's just been giving me trouble.
Bugging you. Yeah, that's rough. Arthritis anywhere is no fun, especially in the knee when you're walking around everywhere. Huh?
Yeah.
So my name's Derek. I'm a student physical therapist working under Dr. Clausen, as I kind of mentioned. And he told me a little bit about your knee osteoarthritis, and what Dr. Clausen would love for me to have you do is hook you up on some electrical stimulation. And basically what that is I'm going to use these pads. I'm going to place them on around your knee, and it's just going to send a current like through your knee basically for pain relief. That's the main idea for it. And in this specific case, I'm going to be trying what's called low rate tens. So you'll feel like a kind of that current go through for a little bit, and then it will stop for a little bit, kind of on like a pulse pattern, if that makes sense, because it's biphasic pulse current. And it's going to trigger something in your body called the opioid release. So have you ever heard of opioids before? Like
pills and stuff, right?
Yeah, yeah. So do you know what they do? Like why people take them or anything? If you don't, that's fine.
I think they usually give them to people after like surgeries and stuff.
Yeah,
right? Yeah.
The biggest thing is for pain relief, and the reason they actually know that those pills, how those pills work, is because your body creates natural opioids as well.
Oh, really?
And yeah, pretty crazy, huh? So what this is going to do is it's going to like stimulate an opioid release in your knee to relieve the pain, basically.
Okay.
Does that make sense?
Yeah.
It might be a little painful, but it shouldn't be too painful. That makes sense.
Okay.
So it'll kind of make more sense as we're going, but that's kind of the general idea.
Okay.
So in John's case with osteoarthritis, we're using tens, specifically low rate tens for the pain control, as I just explained to him. Contraindications could include tumors or malignancies, skin damage, rashes, if he's had a knee replacement maybe, pacemaker, that kind of stuff. So I'm going to ask him about that quick and then we'll get going. So John, do you have a pacemaker by chance?
Nope, no pacemaker.
No? Have you ever had surgery on your knee? No? Okay. What about like, I'm looking at your skin right now and I don't see any rashes or cuts or anything. Nothing like that?
No, not recently. No.
Tumors? Nothing like that?
No, not that I know of. No.
You're not pregnant, obviously, so that's good. That's another one.
Not that I know of that either.
Yeah, not that you know of. Good. All right, so knowing that, I would continue with treatment. So to start, John, what we're going to do is I'm just going to take these pads and I'm going to place one on this side of the knee. And we're going to place the other one on the other side of the knee. Now, they're not sticking the greatest right now, but hopefully they are sticking enough to make it work. So if not, we can try some other pads. Try and get those on. That's probably good for now. Okay, now that the pads are placed around the affected area, we can set the parameters on the machine. So, since we're doing low rate tens, we're going to do biphasic again. Treatment time can be anywhere from 20 to 45 minutes, but in this case, I'll set it at 20 because that's what you normally do. But in this case, we're just going to do 30 seconds of treatment. As far as like a duty cycle, I guess we could start over here. Let's do rate first. That would be like the frequency. In this case, you want it to be really low. You want it to be less than 10. We don't want it going off too much. That's why it's called low rate tens, because you're setting it off at a low rate. So I'm going to put it down to about 8. Then we have the width. And the width, we want like pretty high, but nothing greater than 200. So I'm even going to turn this down a bit to about 150, I think is what I'm going to go with. Time at 20, rate 8, width 150, so low rate tens. And again, I guess with the duty cycle, for duty cycle, we're going to set it to continuous because it's for pain control. And I'll just double check all my parameters and we're good to go. So now for the intensity. So John, I'm going to be turning up this machine and it's going to send the current through and you're going to feel it. And I want you to be able to feel kind of like a strong twitch, but not enough where it's like a muscle contraction, if that makes sense. Okay. So I'm going to turn this up and you kind of tell me when you feel that. Okay.
Okay.
I'm going to go scale up on the intensity. The pads are peeling off a bit. Sorry about that.
Ah, that's alright.
Do you feel anything yet?
Let me think. No, not picking anything up.
Okay.
Still nothing.
Nothing.
Mm-mm. I'm starting to feel just a little tingle.
Feel a little tingle.
Yeah.
So we're getting there then. Once we get that kind of light twitch or strong twitch, I guess, then we'll stop there. So, is it painful at all?
It's getting close. It's starting to. I can feel the.
They also
The
call this
beating,
like
yeah.
a acupuncture, like TENS, where it's kind of like a prick.
Yeah, I'm starting to feel the beating
Feel that?
going. Maybe a little bit more. Yeah, right there. I can feel
There?
it. Yeah, it just feels like almost like a little needle poking.
Does it?
Poking in.
Yeah. So you've hit that spot then. Good. So in this case, with the opioid stimulation, the release of opioids, that's the goal for pain control. In this case, which is why we need that really low rate, but a very or a higher duration though, where it creates that kind of pokey
Yeah.
feeling. That you described it like that.
Yeah.
Almost like there's a needle kind of hitting you.
Yeah.
Does it hurt though?
Not really. It's not like painful. It's not worse than the pain I was feeling before, but
Yeah.
it's not super comfortable, but it doesn't hurt. Yeah.
Yeah. So normally we leave them on this for 20 to 45 minutes to kind of optimize that opioid release technique. In this case, we'll just go for 30, and it's already been 30. So I'm going to shut the machine off. Then I would remove the pads from John. And then we would report to Dr. Clausen and see what's next in treatment.